Good afternoon, everybody. This is Bill Kanda, Custer County Chairman of the Board of Health. This Wednesday, March 2nd, 2022. And it's just a little after 1:30, 1:34 on the official clock. Cliff, we're waiting for Clint to get here. Our good attorney, and thank you for coming today.
I'm the good attorney.
There you go. This meeting is being recorded on Zoom, and are we on YouTube too? I'm assuming. It is zoomed. So I'll call this meeting to order. Please silence your phones, just in case you haven't already, and let's stand for the pledge. How about Dorothy giving us a try?
I pledge allegiance
To the flag of the United States of America
and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you, Dorothy. Okay, and Dorothy, I was going to tell you this, but can you give us the roll call today?
And we have Kevin Day,
Present.
Tom Flower,
Present.
Bill Kanda,
Here.
Dr. Clifford Brown.
Present.
Smith.
Yeah.
I am present.
Thank you. And myself, Dorothy Karsten.
Okay, we got everybody, and that's everybody in the room, and we can continue. No other audience or introductions. Anybody show up online? Probably not. This agenda has been kind of confusing to follow through the last couple of weeks, actually, because I found out Dr. Brown is in heaven. If everybody tries to check for the agenda phone, it wouldn't pull it up because it was hiding below where you would be looking. It was there, but you had to know to scroll up in a different place. I think I do believe that Jordan fixed that, but you might try asking about that if you're using your cell phone. Additionally, they are working on a new website for the county, and so hopefully that'll help people with their computers to find things better and easier. So do we have any amendments to the agenda? I don't have any.
Yes.
Okay. Thank you. And we don't have any minutes. I don't believe we are doing any either. It's the last meeting. So with that, anything, Tom, you want to bring up?
No, I'll speak to something when we get to it.
Nothing. How about you?
Nothing here, sir.
Okay, the only thing that I've seen recently that is in the works is that they are lightening up on the mask mandates, but the hospitals are all different. There's visitors that are allowed, there's some that aren't allowed, there's teams that you can have, et cetera. So maybe you can shed some light on that later. If there's any. Okay, Dr. Brown, it's up to on you now to bring us up on what you think is important here, COVID status wise, and we can talk about whether it's COVID we're reporting about. I think you had a request in at one time. You're reporting now on really being the public health director on all diseases that we need to be tracking. COVID's kind of in the class now where it's played down and it's going to be treated as another virus.
Bill, can I ask a question? Is Dorothy officially appointed as the secretary
Yes.
of the Board of Health now?
Yeah.
All right.
And
Did we do that?
actually, no, the official is Dr. Brown.
Okay.
I guess we had Tina calling and the roll call before when as part of the job.
Who's taking the minutes?
So the minutes are, we have asked, I did anyway, ask her to take minutes. And that was what Tina was doing as well. But Dr. Brown is the official secretary for the by statute. Okay, Dr. Brown.
Okay, I think all of you have paid for Cedars. I'll let you know, and I will. It's the very first page. It should be at least on your little back of the papers. I made a note up here that, and that's since Friday, and Monday, that the dashboard, the numbers put out by the state are so variable and unreliable that I have ceased publishing percentage positivities. Unless asked for it, I can give it to you, but to give you numbers that are not indicative of reality seems to be somewhat less than productive.
So what in its place, what's productive to look at?
Well,
hospitalization.
giving you just actually the numbers instead of
Okay.
the percent number, since we have a small population and one or two people really makes a difference in positivity where it doesn't make any difference at all when you have 3 million. So we have today 3 positives. Now, as I have commented before about the epidemiological wing of our reporting system has been playing catch up, and they were terrifically behind with the Omicron because they're just plain overwhelmed. There's no way they could keep up. The labs couldn't keep up, so they couldn't possibly keep up. But anyway, now they're playing catch up. So we get people from several months ago getting reported positive when it's been several months, and we have no way of using that information to warn people or to trace or track people or to do investigations. In other words, to actually perform public health, trying to keep people healthy. You know, if you can't use the numbers, of what value are they except for the epidemiology records?
Right.
They will apply and supply sometime in the future. So anyway, so I'm going to be giving you guys actual numbers, not their percent positivities for the week and for the 2 weeks and so on. We do have 3 positives currently as of today over the last 7 days. We have a total number of cases of 628. Now this is since we started counting back in 2020. We have hospitalizations in the last 14 days of 0. Now these are new hospitalizations. Okay. We have total deaths. One of the counts in Cedars is 17. Another count in Cedars is 18. The vital statistics program is still reporting 21. But understanding that the hospitalizations, when you drop in hospitalizations, it takes a while for the deaths from people hospitalized to actually show up on this registry, you know, so it can be, even that can be misleading. I know that we had a death occur last Friday, very, very sadly, but
been in the hospital for a long time.
she had been in the hospital for extended periods of time. Anyway, so that's where we are right now. Does anybody have any questions about any of those numbers or challenges or whatever? Not sure I can defend them, but I can say that is what Cedars.
So the bottom chart, you show total deaths, all causes since when? 115.
Yeah, that is from a year ago in March.
So it's a year.
Yeah, it's 2020 in March.
Oh, I see March 1st. Okay. And then deaths due to COVID, they're counting 21. So that coincides with the 21 above.
Right. And that's where I'm getting the number.
Okay.
He sends that to me specifically every week on Monday at 8 o'clock.
And then is total death all causes? What's the difference there?
Well,
Says county occurrences.
yeah, heart attacks, fatalities from accidents for all causes.
So if I add these 3 up, it gets to the 115.
Maybe, because remember that there is a real decision process. It goes through the CDC, it goes through the state, it goes through the coroners and the private doctors, and they make the choices. And in 3 months, they may remove 2 or 5.
But the 115 came from the same place the 21.
Yes, exactly. You don't know
Okay.
who is going to be or who has been assigned, and it may change for you at any time.
Okay.
So,
If I may, Mr. Chair.
Go ahead, Tom.
I look at that chart and kind of have a tendency to shake my head. Custer County residents, pretty clear to me that we've had 21 residents of Custer County die from COVID.
yes, sir.
The Custer County occurrences, I just cannot get my mind wrapped around what that really means.
Okay.
Right.
What they're, and I quizzed him on that, the same thing exactly. And he said, those are people who were in the confines, within the confines of Custer County when they died.
Not a resident.
Not a resident.
So the other 21, some of those could have been in a hospital out of county and died.
Exactly so. But they are assigned to us because they are registered as Custer County residents. So the others are just.
The 4 literally occurred in Custer County. So 17 must have occurred outside of the county.
No, the 4 do not count in the 21. The 21 are strictly deaths of residents. The 4 are non-residents who died, who physically passed away while they're within the parameters of Custer County.
Not residents.
Not
We
residents.
just had a title there that said non-resident deaths in Custer County.
And that seems like it would make sense, but that's
Yeah, that's crazy.
not how it's reported.
So they're just assuming because it doesn't say residents, it's not in the, not residents then.
That's right.
And so that means there were 67 non-residents.
So they could have been visiting here.
Yeah.
That's right, exactly.
4 of those.
Yes, exactly.
And we get charged with that or did?
No,
home
no, we
county?
do not. It's just that is the complete report from the vital
You
statistics.
know, and then
program of the
that's
state.
kind of interesting because 67 from all causes, that's a pretty high number in a year. I'm surprised to see that.
It is high.
For
And
Custer County,
we don't
maybe up
see
here
that.
visiting
Yeah, yeah. We don't see that being reported in newspapers. We don't see that.
because they don't live here
Because they don't live here.
Yeah, traffic deaths,
Yes.
climbing deaths.
or sitting in a hotel room or
That's right.
sickness or pain.
Well, thank you. That does, if we add non-residents to the top of that Custer County occurrences, then
It
that
would
makes
make more
sense.
sense.
Yeah.
Yes, sir.
Okay,
And I asked them about that, and
this is what you
Would you
just,
be able to add that?
I can add that for you guys. What I do is copy and paste this, so there's no question ever that Jimmy, the numbers, so I can put that in a separate.
so what are we reporting now to the citizens of the county on this?
We report 21.
And we don't state anything. Okay,
Basically, those people might have been visiting. They would make a difference to them, but to our county in general, I don't see how it does.
and
I
the
will
21 are
do it.
residences, so
Yes,
that's
yes,
legit.
those are the people that I think most people are kind of concerned about.
Yeah, when I understand what that number means, I find it interesting. I don't know that the rest of the
I don't think the
residents of the
county
county would care one way or another, but
confused.
it is impactful to us because that means we're expending resources to go deal with those deaths and typically including a $2,000
EMS call.
man, the name just went away. Autopsy.
Autopsy, yes.
So
That'd be interesting to know is how many
Yeah, 'cause-
autopsies were they all actually performed or not?
No,
Probably not.
because out of the 21 are hospitalized over in Parkview or wherever, you can end up having that particular,
Right, even the 67 them,
yes,
it's not necessarily
right.
here.
not necessarily.
before it's require an autopsy, and we'd be on the hook for that.
Still
Yeah.
Died
dollars.
in our county.
Right.
Pueblo County or El Paso County, they're on the hook for it. So
Maybe we should ship.
That's been part of our conversation. Ambulance service.
We don't do
Yeah.
autopsies for a death in the hospital. I mean, it's an unattended death, isn't that what autopsies are for?
No, on these, where it's due to COVID,
They're looking.
they have to evaluate and out of it could be 1, it could be 15 different diagnoses that particular individual carries, okay? Then they have to determine which, and so it tends to be somewhat subjective, but which one it was that actually caused the death.
and families can request an autopsy
Yes,
as well.
yes, exactly. They will.
At that time, then they,
Or not.
Yeah, I don't know if the families requested, if they have to pay for it or if the county has to pay for it. I'm not clear about that.
Yeah, I don't think, at least in other states, I know that they did not. It was not charged to the family. Anyway, that's kind of where things go.
Yeah, well, thank you. Certainly clears it up for me.
Yeah, I'm sorry that that was still.
How are you reporting it to the public? Reggie putting out just a
She
blurb
just gives the number
on this website and on
Right,
in the
yes.
papers. Okay,
from X date to the present.
okay.
And that's the Custer County website.
Yes. it is. We have in the state, just to kind of give you an overall picture of what's going on in the state, about 50% of the residents of Colorado, not Custer County, but Colorado, have been vaccinated. And then we have an additional number that's pretty substantial, particularly now after Omicron, who have been naturally, quote unquote, vaccinated. In other words, naturally
Natural immunity.
stimulated to,
You're moving on to your vaccination page.
well, actually, this is right down here at the very bottom.
Oh, okay.
On Friday, we did, the number have fallen somewhat. We people who what they need to do if they or they're developing symptoms or anything like that, then they will do their home test. And if that shows up positive, because that test is notoriously false negative written, then they come in on Fridays and get the real one, get the PR. It is more accurate. And so we had 14 people show up even on Friday, even though everything is dying down as far as hospitalization, as far as deaths, as far as case numbers and so on. Still, we had 14 people come in responsibly and get tested.
Want to verify whether it's positive.
That's right. And that's the way to do it.
Yeah.
So if they have to travel or something like this, it's free, it's there, and it's the best that's available.
And did you say that their bus wasn't able to be here?
No, that's, the bus is for the vaccination.
Gotcha. Okay.
This is the van. I know that's.
Okay. And so the state did those, you don't do
Yes,
those?
that's right. We do not pay for them. We don't do them. This is a private lab, which is why they get them back by 2 o'clock the next morning.
That's the van that parks in front of your door.
That's right. And they come in, I actually give them, since it's been a little coolish lately, I actually set them up in my office. I watch them to masks that way for people who need to have
Yeah,
some
I actually
protection.
used that foot op on.
See, such a deal.
They wouldn't let me in to get my foot unless I had it.
That's right. Exactly. So anyway, that's kind of where we are. And we have just, I can mention this right now. Our cutoff for the vaccination bus, because this is very expensive, a whole clinic in there of people. That was the 31st of March. It has now been extended until the 1st of July.
Oh, holy
So
smokes.
FEMA
Trying to figure
FEMA
out.
is still going to be supporting 100%. That's why it doesn't cost us anything. 100% dollars from FEMA
Yeah.
to keep those vaccination buses. And I work very closely with the lady who manages this for the state so that she makes sure that we're first dibs on this particular bus when it's running and when they can make it through the snowstorms.
Interesting. Has it been attended pretty well?
It really is.
Yeah, I've never yet to this day seen a clear consost of vaccinations and tests.
I don't think that's certainly not be to me.
I would guess it saved us a lot of money.
Oh, yes,
Yeah, I'm sure it did.
Yes, believer, certainly has.
Would you take a stab at what a vaccination would cost?
We were kind of working on that. And even Scott Bookman, who is the incident commander for the vaccination and COVID and so on program for the state, said it could easily be a couple of $1,000. I mean, the amount of money that's been expended is horrendous.
Yeah, you just don't hear anything on the national
That's right.
news about it.
That's right.
State stuff, workshops.
It's because they printed the money to pay for it and they don't want to lose it.
Yeah, if you notice in the new bills, they have little injections.
So, yeah.
Sorry.
Yeah, I see now there is some talk about what the federal government's going to do with the millions of
Doses are 11 doses.
vaccine doses that they bought, and now they don't think they're going to need them. Same with masks. So,
You know, and the need will be determined by where the next variant goes and whether or not it's affected by the vaccine, whether or not the vaccine is effective in limiting its course or whatever. And obviously you have chances on each side that it's going to be really effective
Or
and
not.
it won't have anything to do with the price of fishing.
Or the germ will be effective or
That's right.
not. Or the
Exactly.
virus, I could say.
But we are continuing to do shingles, herpes zoster
You doing shingle shots up here?
all the way through.
Have you?
It's about, no, you may not quote me, even though this is being published. It's about $125 and they just went up.
Medicare paying for them, or is that a private?
It can,
I know you go down to a pharmacy and get it for free.
not
Or
shingles.
Medicare, Medicare
Yeah,
covered.
Medicare, if Medicare covers, it will cover at least partial. Yeah. And a lot of private insurance companies.
But up here, you're not turning it in and managing that then
We do
to get reimbursed for it.
We do charge and because we have to pay for the vaccine.
Right, that's what I'm
Yeah,
saying.
so we charge exactly to the penny what it costs us.
Okay. So those, go ahead.
No, I'm sorry to interrupt.
No, I was just gonna say, so the local guy paying for it is not getting any cut on that at all.
No, because
Medicare, you can't.
we don't have any help
Okay, that's what I thought.
to pay for it.
Okay, people have asked me that question.
Yeah, that's exactly it. And so I know, and I can't give you how much, but it went up several dollars
Yeah.
just this week.
Tom, go ahead.
So in your documents, when you
Yes,
say
sir.
vaccinations,
These are COVID
Okay.
vaccinations.
if
To be
it's a
specific.
shingles vaccination or flu vaccination, you would
And I have given you guys those things in the past. I give them to you kind of quarterly. So by the end of March, I would suspect that I will be able to come up with that again for you, just to kind of give you a running tab. We're putting out. We have made deals, so to speak, over the table with a vaccine company, and they put in a certain amount of money. And if we get more money coming back in from people paying us, private individuals paying us for that particular vaccine that they got, if we don't get enough to cover all of our expenses, then they will kind of cover for us. If we take in more and it balances out on our side, then we actually get a check back so that we can buy more vaccines. So that's kind of how things are.
And the vaccination bus is just COVID.
Just
They don't do
COVID.
Anything else.
Yeah, and they give everything from little kids.
Yeah.
All the
They
way
don't
up
do
and all the
flu
different
shots.
types. No, they
Shingles.
hadn't been. However, the last time they were here, they were talking about giving COVID shots and flu, since that has been okayed by the CDC. So
It has not happened yet.
that has not happened yet. And I have some questions about that. And I think it'd be really simple to understand that if you got 2 shots and you had a response, systemic response, full body, how would we know which one it was if you got 2 that same day?
Yeah.
And you need to be able to know those things, because you have to be able to respond pretty quickly to cut down that inflammatory response. Anyway, so just to let you know, that's why we will do it if somebody's just desperate, but we try not to do that
Okay,
to anybody. There have been some
so
changes.
before you go,
Go ahead.
so what's your plan for a health fair then regarding,
We have not set up a health fair
Okay.
now for 2 years.
okay, I know. But we can talk about that later.
Yeah, they're hopefully a year from now, we'll be back into where we can function
Give shots and do
normally.
other things.
Yeah, because we are giving all the other shots, it's just not
That's why
the whole
I
thing.
asked.
Yes, of course.
That's a benefit that I know people have voiced to me. The
Yeah,
lack of one now is
yes, true.
It's not,
disappointing
Yes,
because
it is.
they have utilized that many times in the
For
past.
sure.
And
it works very well.
And
It's a
they're-
service.
they're hoping that we can do that
So are we. I'd much rather do that than this.
So,
Yeah, it's a real service, but it takes a lot of time, a lot of planning, a lot of, contributions and so.
Have we had health fair since you've been on board?
No.
Okay, I didn't think so, but I could.
Came right in the middle of COVID.
Yep. That was
I had a question.
Yes, sir.
Can you get a booster to your booster?
They're really not so much boosters. They're an additional, there's a little variation given.
So is there a limit? Can you get 4 shots?
Yes, you can. People who are autoimmune compromised, who are really, really potential there for having serious illness, the CDC has cleared them to get,
For COVID.
for COVID, a 3rd and 4th, and even sometimes the 5th. In other words, every few months.
Okay.
If they have, for instance, if this person is undergoing cancer treatment, okay, they have no T cells, they have nothing left. They've had it wiped out.
So they're compromised.
Yeah, all compromised. They have no way to defend themselves. Then CDC has said, okay, we will allow you to come in and get a 5th like every couple of months because you got to keep it alive. And you have no way to do it otherwise. But for a normal, healthy person, no, we're kind of careful on that one.
it's probably almost a no.
Almost a no. Yes, sir. I should know, right? Okay. There's been and I'll touch on variants now for a little bit. This B2 variant, the most recent one, does not show any significant spike in percentage of the number of people getting sick showing up. So it's been almost a non-factor, which is kind of nice. And all the others are dropping, and they're dropping precipitously. So
it's mutating into something less virulent.
well, we have had so many people get sick.
Yeah.
That they are
It's
now,
choking it out.
yeah, that's
No
the
place to land.
natural immunity.
Yeah.
Exactly. Yeah, so it's actually doing quite well. And that's what we were hoping for, is something that didn't kill a whole bunch of people, but would make them a little bit sick and make them.
They're not going to stop until they unload some of the vaccine they got there, even though it's not doing anything.
No comment. Yeah. So there's been no real big increases. One of the things that you guys might be interested, because you may get the questions. Remember the problem with young boys getting the vaccine, that they're having cardiovascular problems and serious. They found that if you go from having the vaccine being given from a couple weeks apart to putting it up to about 8 weeks apart, surprise, surprise, you don't get
No problem.
the response anymore. It gets way down in the incidence. So that's what's being advocated now.
That's why you have tests before you put it on the market.
Let's see.
They would have known.
That's it. Okay, we're down statewide now to 3.74% positivity. So that has dropped just within the last couple of weeks. It has dropped a lot. From up around 7, it was even higher. Our hospitalizations are down to 321 yesterday, for instance, instead of 1,200. So things are really, really starting to come down. The deaths are way down also, but remember that lags behind hospitalization numbers. So
Where are we at here?
Yeah, where are you reading that?
I'm just giving you information that I have received within the last 3 hours.
Okay, I'm sorry, we were trying to follow.
No,
Yeah, I was looking for it.
So that's why we asked.
Bottom line is no spikes.
Right, no spikes, and
Commissioner's office.
even though Colorado is not as low in its percent positivity right now as some of the other states, we are still coming down. It's just some of the other states that were so high have dropped faster than we have. Okay, so.
Okay, I apologize. I'm sorry to have that meeting.
Okay,
That information.
we still have publication of numbers. This is for your general education. If you've been vaccinated, you still have 9.2 in Colorado right now, 9.2 times as little response, a risk factor, okay, for getting really sick and getting hospitalized. You have 15 times less chance from the statistical analysis of dying. So just if people ask you, you can give them some numbers. We have, as of not today yet, but probably within a week or so, there is a whole program that has been developed and is being enacted. They haven't finished off all the fine details yet, but you can walk into a pharmacy, get tested, and if you are positive, you don't have to leave the pharmacy without getting vaccine. Not a shot, but a pill. Okay, so the pharmacist doesn't have
Therapeutic pill or is it?
Yeah, it's an antiviral medication. So it is progressing. You know, you guys are asking me, and we were all asking, yeah, this is great. Try to prevent it, and if prevention doesn't work, what do you do? And
Why would you die?
yeah, exactly. Okay, any questions? No. Okay, I wanted to kind of touch base with you. This kind of colored, it's red and green and blue, and then a big gold swan. Yeah. I think the rest of you probably have it.
This is the governor's last.
Yes, last hurrah. Okay, we'll go past the table of contents. Colorado is the third page here. Colorado's innovative response. This is, we call it propaganda in certain countries, but anyway. We have just a listing here that you can go down and quote 10th lowest number of deaths per 100,000. This is comparison to other states. Okay, so you can kind of glance down through that. I won't spend much time on that. We have other things to go on to, but just for your information.
So the 91% of Colorado was, I like to add the O because that's the name of our state, immune to Omicron infection and severe disease.
Now, yes, currently.
Yeah, so I have no idea because I haven't read all this and I did not follow up on his press conference last Friday. Would you imagine that part of that 91% is due to
natural
immunity?
Yes, sir. Okay. Yes, a significant portion is due to natural.
Because you look at that and think, well, yeah, that must be from all the vaccines.
Yeah, it's not.
I'm not buying it, but
No, it's not.
Especially if only 80% are vaccinated, but they're not. That's just with one dose.
That's right. But we actually do pretty well. We have about 75% in our county who had one dose. So that's kind of the minimum just to stimulate off production of.
those numbers are kind of impressive if you look at it from a statewide deal. I mean, crying out loud, 18 million test results. That's
Makes you mad that there's 56 million masks to the schools. So.
Well, it wouldn't if you were a mask believer, but
I know. That's what I mean. Or but if you cared about your kids, you sure do.
Okay, moving along. The next page also is just kind of for your own information, claims to how great we are. Colorado State Lab became the first lab in the country to identify variants of concern. So you can read those at your pleasure.
I don't mean to be negative, but we don't meet very often. So the whole idea about the free testing and the free vaccines, I wish they'd say government sponsored because they're not
government
free.
Paid for. Yes,
we're going to pay for that, I'm sure, through our
we
taxes.
are. Yes.
Already.
Yes, big time.
Yeah.
Yeah, it's not free for the state, it's not free for the county, it's not free for the federal government.
Right.
I always say, that.
Easier,
Makes you think.
sounds better to say they're free.
Well, it gets you votes when you say I'm gonna give you
Yeah,
something
that's right.
free for you.
That's right. On the 5th page, our roadmap is moving forward. I want to call your attention to the second paragraph. The end of that first sentence. If your household is fully vaccinated, then you should feel comfortable to now proceed with life as normal. What they don't notice or make mention of here is that a lot of people have had, and it's more effective, have had the illness.
Back to that
Same thing.
community that, you know, I think back, good Lord, it was almost like we were archaic in the first 6 or 8 months of this whole thing. And when anybody brought up herd immunity,
You're
God, they were
ostracized.
ostracized, man. It's like, what are you, a communist? You
Yeah.
want us to die in order to build up herd immunity? Well, that
Yeah.
wasn't necessarily, looking back, that wasn't the case.
You didn't die.
The disease and build up herd immunity. We didn't have to lose a third of our population.
And we wouldn't keep
Less.
getting more sick. That's right.
So,
But thankfully, understand there was a balance there. That when we had the Delta variant, we had a significant number of people dying, lots of people dying. And the vaccine helped some. Once again, that's in a short-term measure. The people who got really, really sick, and we've gone through this even in our county, most of them had not been vaccinated.
But even though that, Cliff, you're right, but in the big picture, the amount of deaths actually weren't any more, even less than the common cold.
Yeah, not even close to what was we were having these numbers thrown at us.
But in an isolated look, yep, they jumped up and we had more. You're right.
and you know, to your point on that statement, Cliff, if your household is fully vaccinated, obviously there was questions moving forward. What does even that mean?
Yes.
You go back to this,
Yeah.
the results page, 81% of eligible Colorados have been vaccinated with at least one dose. Does that matter? If you look at the big picture, it doesn't. It doesn't matter if people, not if you believe everything we're told, because they say you're not.
If you're
you're
not fully
done
vaccinated, it
until
doesn't
you've
work
had
if you
3
want a shot.
vaccines. So
Yeah.
I always look at that number of one dose and think, why are you even telling us that when you're really saying in the other side of the face that unless you've had 3 vaccinations, you're not fully vaccinated.
And it's a moving target.
And that's the point,
Yeah, it keeps changing.
because
and that's
why are you
what
using the
people
first
don't
shot
trust.
then at all if it doesn't work?
Right, and which they told us it didn't,
Told us,
right?
yeah.
Basically, they said, hey, one's not gonna do it, you gotta get.
And then they
another.
said 2 won't.
And then they said 2 won't work, so you gotta get a booster. So I don't know, I just struggle with the whole 1 vaccination numbers, but I'm assuming when they say fully vaccinated now, they mean 2 vaccinations and a booster shot.
Yeah, now it's and a booster,
Is the booster different? Dosage
half a
different?
dose.
Okay,
half a dose, half of what each of the doses were previously.
gotcha, thank you.
So anyway, what we look for now, what I'm looking for now is for people to act responsibly and to stay home when they're sick for at least 5 days, at least. 5 days.
Yeah, which really should be the message now.
Yes. exactly.
Even though there are a lot of places that are going to 3 days.
Yes, sir.
I believe even
Or no day.
Yeah, it
school
depends.
districts that I know of.
Right.
went to
Depends on the
3 days.
variant, and right now it's dropping. So even the CDC, which is notoriously very conservative, is dropping the times. Okay,
So we're looking at your notes on this next page, are we?
yeah, those are my notes on the next page. Those are my scribbles.
I thought that was a cute way of a new way of putting a chart together.
Well, as opposed to chronic, it's no acute.
Yeah, it's a cute.
Okay. So my thought process and preparation for these things, basic approaches. Number one, if we can be prepared and trained, then we can sustain the knowledge we can develop and put into practice, the knowledge of the things that we've gained in knowledge over this last 2 years. And if we don't gain in knowledge, heaven help us all, because it's been painful enough that we should have learned a lot. So we also have a certain minimal preparation and training. We don't want to wait, and I'll ask Bill to expand on this. What is one of the easiest ways to get removed to command in the military? How about if you're running training? Yeah. To have a big screw up in your training programs for the military, almost guaranteed removal from command. That means your career in the military is over. So what we need to kind of think about here, we've learned a lot painfully about handling disasters, and disasters do not always come from forest fires. This one stopped a lot more than the forest fires. And a good share of it, I totally concur, is because of the way it was handled, because the mandates that were put on us. But
Or self-doing it.
Or self,
Not
yes.
mandated.
Yes.
Irrelevant.
But
It's
sometimes
how you
we
handle it,
mandate.
Making sure, well, that's right.
So my thought that I would like to have you guys consider is that anytime you go through a lot of training, you keep training, you are ready. So things that would otherwise have been a disaster, quote unquote, are no longer a disaster, because you just go through, you've already practiced it, you know what to do, and you take care of the problem. So that's what I'm going to suggest right now. The newest thing out in the last 4 weeks or so has been to check the water supplies of the communities, because we can identify the pathogens in the water. Does that cost a bit? Yeah, it does. It doesn't cost nearly as much as some of our other quote
But
unquote.
a big level somewhere, somebody's thinking the same thing. So there ought to be a state level.
That's
Is
right.
that what he's trying to say?
That's what they're doing.
Okay.
Yeah, that's what, and so that.
And money provided to agencies to help
That's right.
train.
That's my segue. I am proposing to write for a grant to test our water supplies or wells or, so on.
Well, you don't want to ask a question you can't stand the answer to.
So
Although every well I've ever tested up here because of the septic requirements to put in it, yeah, or remortgaging requirements.
Yes.
Because they make you take a test.
But there are a lot of people who've had wells for quite a while. I would like to.
City supplies are a different story.
Yeah, that's
Big tank.
a very different thing. But I would like to be able to, and I talked to a gentleman named Dan from Pueblo, and another one coming up. His name is Mike, who has worked with us before, worked with Mr. Livengood on water testing and this type of thing for the wells. And I would like to set up a program that is funded through the state so that the individual well owners, some of whom don't have a lot of free and easy dollars to spread around, it's not free to have your well tested, to go through and on a regular basis, go through at least once every 10 years and have the wells tested here to make sure that what you're drinking, what you're using for cooking and everything else is relatively safe. So without contaminants. So
How big a program is it? How many dollars?
I don't know yet, because I don't know the state, what the state is going to charge us.
Something to look forward to.
Yes, anyway, but that's kind of what I'm trying to break to you guys, that this is one of the things that I really feel strongly about if we have lead, if we have arsenic and some of the other things in our water supply, our kids really get negatively affected.
Yeah.
Well, I don't think it'd be reasonable to say we're gonna test every well and of course the municipal water system at one time. But maybe we could look at it and say, okay, if you're going to list a piece of property for sale that's got a well on it, that well needs to be tested. They're already doing it. If you're bringing foster children into your home, you have to have your well tested or your water tested. But let's not talk about the municipality. Let's talk about those wells.
Right.
Maybe it could be an incremental approach and say, we're going to start with this. I agree. I think water testing could be an early warning system. We're not probably going to test every well frequently. There's just too many of them. But certainly the real estate industry said, hey, you can't sell your house unless your septic's been pumped. Well, that's only been new in the last probably 5 or 6 years.
But it's showing.
It'd be a great approach to try to say, let's get a handle, let's get started on this well testing.
Anytime you have mines riddling underground, you have an increased potential for pathogens, for various toxic arsenic and other things. So that's why I'm kind of pushing on that. There was a public health director here 2 or 3 directors ago who looked at the amount of cancer here in this valley and said, this is disproportionate, and wanted to test, and something happened health-wise or whatever, I don't know, but she left and it was never done. So I would like to, even if we test certain levels of water, pick out wells that would be, tapping into that particular level of water in the various areas here, to start with that and then slowly work through.
Okay.
Just a thought to this.
I think some things too that are indicative to our geographic location. I use all those big words. Is the radon.
Yes,
Not necessarily on the water, but just because we're living on decomposed granite.
Doesn't that have to be tested now, like in people's basements? Isn't that a requirement
That's a requirement of the state
in the state?
and county too, because
I think so. Yeah.
I've never had to do a microwave.
I'm not familiar with it.
Being a requirement.
All the states
is,
that have lived in elsewhere have had that requirement.
it is, maybe it's only on mortgages, but before you can sell a house, you got to prove it not loaded with radon.
I didn't have to in Pueblo County.
You may not have been there. Well, God, this is a state deal. Maybe it depends on location too.
Could be.
I don't know. I know I had to do it over in
I'm
Denver.
doing one in Fremont County right now, and we haven't had to address that at all.
Yeah.
I know that from the public health information that I've picked up, they said that every basement should be tested on a fairly routine basis.
Should be in.
And it does. Yeah, sure. Yeah.
Yes, sir.
And back to the water thing, let's assume we had a county process. Would that go through you, public health department, to submit those water tests? Or
Right now people come in, but yes, we would actually gather the samples and submit them so that we had good control, so that somebody who wanted to sell their house couldn't just kind of oops and pour it down the drain.
That's the same, I guess it applies. Same reason you have a sanitation
That's
officer on other things.
That's exactly right. So yes, it would fall under the public health, but it would be under a grant. So the county would do stuff. And Jerry Livegood agreed. He said, yeah, that's something we need to do. So just kind of tossing that out. But I wanted to bring this into, as a piece of the puzzle into your mind, because we need to be not letting go of our or PPE or supplies for emergencies. And we have those things now, and we're not going to toss them or anything like that. But I think that we need to keep a vigilance reporting system in mind for the future. And
Sure.
because people are not getting sick from some virus of some kind out of some place, that we do not just say, well,
Okay,
that's over with. Try something else. It needs to be a public health system, not an emergency. Emergency is too
Right.
late.
good thoughts. We're going to have to pick up the pace here.
Yes, I'm sorry. I just wanted, but that's the major impetus of what this whole thing here talks about. So you guys can read the rest of this for yourselves on page number 8. The first little bullet there, or double arrow, ensuring critical supplies and PPE move in just-in-time ordering to adequate supply at hand. In other words, I don't want to have happen what happened nationally when a particular administration decided that it really wasn't important, so they could kind of dispense with those things, and then we got hit with COVID.
Mhm.
I also want cross-training of healthcare workers. This is 1, 2, 3, 4, 5. Down in the little bullets, cross-training of healthcare workers, and that's what I am trying to figure out a way to do now to pay for, so that if we had a vaccination nurse or a whatever go down, get run over by a truck or whatever, that we have somebody else to step in and cover. And when we do need to ramp up the response, that we have those people already trained and available.
Good idea.
And the last one, work with all appropriate healthcare providers in the community. So we don't have much in the way of pharmacy. We don't have a hospital. We don't have a lot of these things. And they tend to emphasize here training of nurses. We don't have a hospital, so we don't have a need for 200 nurses. But we still need to have people who are ready and willing to be able to provide care. So, on page 9, let's go down to,
That's where you were.
yeah, I have underlined, I hope did the underline show up in your copies?
Yeah.
Okay. Public health field has continued to lack appropriate long-term and flexible funding. So the technology, the workers, the staff, and so on, it's one of those things that even though you say, well, man, can't we cut back here because we don't have any COVID emergency going on? Not a real good idea. We can turn our efforts into other things, but to maintain the potential there for taking care of people when they need to under an emergency condition. So we need ongoing funding for sustaining this readiness capacity. That's in the next paragraph. And then down this early warning surveillance of wastewater. I think out of all the things that are listed there, that's the biggest one because we have our stockpile in PP. And then you can skip page 10 and go on to page 11. Oh, please. So we don't have a lot of uniform standards. It varies from state to state, from region to region, and across federal government for creating, this is the second bullet, uniform standards and funding for surveillance testing. So that's part of what I was trying to deal with relative to the water and some of the other areas. The radon that you brought up is a very obvious one also. We want to have on the fourth item down the greatest flexibility for individuals to work at the top of their scope of practice, not the bottom, where you're wasting time. You can use a lot of people down at the bottom. And down on the bottom, support ongoing supply chain solutions for testing critical supplies, ongoing resources, local public health surge capacity. That's what I'm talking about. and infrastructure, and then the bottom, address inequities. And I have brought this up to the state. And I almost did today, and I bit my lip, because after a while, they don't listen to you if you keep saying the same thing. But we have an inequity in our county that I've talked about several times, even in here before. And that is that we have so many people who are 50 years of age or above, which puts them in a higher risk category for all sorts of problems. And yet that is not recognized because they're not a different color or one of the recognized nationalities. So I would like something to equalize people across the board. And I don't care what nationality they are. I do care about what age and what their problems are here, so that we can kind of plan for being able to take care of them. And the last page, well, almost the last page, remove the various streamlined fiscal processes so that small community-based organizations, community centers, and so on, apply for federal grant funds. And we're trying to do that and to get support from RISA for ambulance transportation. And you have almost made it through and survived. Very last page. We're grateful for all our Coloradians. We had a lot of people, I mean, an immense number of people in our community, in our valley, step up and volunteer when we needed them. That was an extremely impressive response. So the Colorado response story is one of the Resilience Foundation's problem solving. And very last page, recent Custer County PHA Public Health Agency acquisitions. We now have boxes.
Yeah, that was back on our
Yeah.
second page.
Yeah, I'm sorry, yes.
We had to get out of our package here.
Yes, so your packet was the second page. The business that we just got in, we just stored it yesterday. We now have available the test kits. So when people come in, we will give them 2 kits per person in the household, so that if they start to get sick, or if we think they might have been in contact, they can test. If one test shows negative, they need to do the second test and make sure. If it's positive, then they need to come in and get tested with the real one on a Friday afternoon or Friday midday. Okay, so it's available now without you guys having to put out any money from your budgets. So 2 tests for each person in the family. And so we have all those things, and we can answer questions for them. We've had some variability on the bus showing up. We have it a couple times, like I said before.
What's the number based on? Cliff? Is it based on 4,000 people in the county or what?
It's based on 5,000 plus.
So you got 10,000 test kits.
Yes. Well, we have about 2,500 test kits because there are 2 tests in each kit.
Okay.
So just multiply times 2. Okay, so anyway, if anybody has questions, when they're.
So who's be putting the notice out on this?
Yes.
How are people gonna know?
Well, I'm going to put it in the papers, and we'll put it in the radio, and put it on our website, and put it in the, what's the other one? The one that Jordan contributes to, Facebook. Okay. So we have saved the people in our county because of the hundreds and hundreds and hundreds of vaccinations that they have not had to pay for, that they pay between $145 and $165 a piece for, even in the county, to get them done. If you go outside, you can pay 200 plus.
Yeah. Okay.
So there's been a lot of money that people have not had to put out in this recent time. The other thing is that we still have some of our, and we're going to be applying for more federally funded mask acquisitions, but we still have about a half a box of masks. So it has been an interesting trail to watch, as the federal government has finally admitted that this is what you need. Wearing a piece of cloth across your face doesn't do it.
Yeah.
Okay, questions, gentlemen? Comments? Suggestions?
Just drop by and pick up the test kit.
Yes.
Just
Certainly
knock
can.
on the door or something.
Yeah, just knock on the back door and push on the doorbell
Okay,
and they'll be signed out to you.
all right.
And if
So you track them, so you're not gonna give somebody
Yeah,
two in a row.
Yeah, that's what I was just gonna say, just what we've been doing with our masks.
Okay.
We just write your name down, phone number, and how many we gave, okay, for the family. And if they then need to test again, then we will give another set out, because we have 90 per box and 42 boxes or something like that I ordered and we received.
Okay.
So,
Yeah, I know there's a House bill being considered, totally different subject here, about Board of Health members being falling under the whole idea of mandatory reporting of abuse, neglect. There was a big question about that. Does that extend to Board of Health members as a law? It's not real clear, but they're going to have that conversation at the state level in the legislature. The proposed bill would include us.
yeah, that's a can of worms. That's a big can of worms. Because I know in Canada, anybody can make an accusation, and until proven innocent, you are almost assumed guilty by the Social Services Department in Canada. And they take kids away, they do all sorts of things, and find out later on that it had no validity. It was just a neighbor that was ticked off.
I think generally accepted, anybody in the healthcare field is by law required to report.
Yes.
The question was, does that include members of boards of health? So it'll be interesting to see.
Should be, I guess, I don't know.
Yeah.
But for sure you.
Yeah, I cannot without the woman's consent report that a woman has been abused. She has to say yes. A child, absolutely, I can nail him to the wall. The husband, the same thing. He has to say, I have been abused. So anyway.
Well, good. I'm glad to see this report from the governors moving forward. And I just did not take the time to read all that and listen to that. So I appreciate it.
So here you are, captive audience.
First kid on his block to get,
That's right, first kid on the block.
and Clint will be the first kid to get the vax test.
That's right.
I'm gonna stop there on the way home.
There you go.
Anything else? Now you got any sanitation issues other?
Not that I'm aware of past what we've already discussed for the water as a potential future grant.
Okay. Any other questions, guys?
I'm good here.
Do you have any questions, Dorothy?
I paid her off.
Oh, I think we're in pretty good shape. Is anybody online? Anybody watching the show here?
We don't have anybody on.
Okay,
So our next meeting would be
1 month from now. Which is what, April the 5th? No, April is, no, when's our first two meetings in April?
Fourth and fifth, or
Fourth and fifth, fifth and sixth.
So it would be
6.
the afternoon of the 6th.
Okay.
And practice posting it and let's see if anybody calls and wants to find out when it is.
That's a 1:30, correct?
Yeah.
very good.
Great. It's,
Board of Health meetings that we were having here.
oh man, they were terrible. So it's 20 till 3. That's during the meeting now. In the discussion.
Thank you for the information.
Good job.